morning, Miss Lopez. How are you feeling today? What made you book this appointment with me?
Good morning, Doc. I booked this appointment because I have been experiencing breathing difficulty lately and my cough is going for about 2 weeks now.
Do you have any travel histories or have you been exposed to places for the past few weeks?
All I remember, Doc, is that I have attended a health seminar at the barangay about health promotion 3 weeks ago. A week after that, my cough started.
Aside from breathing difficulties and cough, what other symptoms or unusual changes did you feel?
I have fever, Doc, and I often feel so cold and I don't want to eat. Sometimes it's painful for me to cough and even just to breathe. I also feel so weak and tired most of the time. What's wrong with me, doctor?
I'm not very sure, but the symptoms that you're experiencing right now are similar to pneumonia, but we cannot fully confirm it without running some lab tests or diagnostic tests. I advise you to come to the hospital as soon as possible to diagnose your disease and treat your condition as soon as possible.
Oh, is it really bad, doc? But okay, I will meet you there tomorrow morning.
Alright, for now I recommend you to rest and don't engage in heavy or exertional activities because this will worsen your breathing difficulties. Okay? Okay, I'll
Okay,
see you
doc. Thank you
tomorrow.
so much, doc.
Thank you, thank
See you,
you.
doc.
Good day, everyone. So, the scenario that you just saw is an imitation of our case presentation about pneumonia. So, our patient is a 61-year-old female who is diagnosed with that disease.
So, what is pneumonia? Pneumonia is an infection that inflames the air sacs in one or both lungs. The air sacs may fill with fluid or pus, purulent material, causing cough with phlegm or pus, fever, chills, and difficulty in breathing. A variety of organisms, including bacteria, viruses, and fungi, can cause pneumonia. So now let us discuss the types and causes of pneumonia. The first type of pneumonia is the community-acquired pneumonia, or what we know as CAP. From the name itself, it is acquired within the community, outside the hospitals or healthcare facilities. So the CAP or community-acquired pneumonia may be caused by bacteria. The most common type of bacterial pneumonia is caused by the Streptococcus pneumoniae, and this type of pneumonia can occur on its own or after you've had a cold or flu. The second type is the bacterial-like organisms, which is the Mycoplasma pneumoniae, and it typically produces milder symptoms compared to other types of bacteria. The third type is fungi. This type of pneumonia is common in people with chronic health problems or weakened immune system, and also with people who have inhaled large doses of organisms or pathogens that causes pneumonia. The fungi that cause it can be found in soil or bird droppings and vary depending upon geographic location. And the last cause of pneumonia are viruses, which includes the COVID-19 virus or coronavirus 2019. So some of the viruses that cause colds and the flu can cause pneumonia as well. So viruses are the most common cause of pneumonia in children younger than 5 years. Viral pneumonia is usually mild, but in some cases it can become very serious. So just like the coronavirus 2019 or COVID-19, it can cause pneumonia as well and can lead to further or severe complications. Now we have the second type of pneumonia, which is the hospital-acquired pneumonia. From the name itself again, this type of pneumonia is acquired within the hospital setting, and these bacteria are more resistant to antibiotics because people who get it are already sick. So as we all know, this type of bacteria has been already exposed to medications or antibiotics, which makes them more resistant to drugs or other medications. So people who are on breathing machines are often used in intensive care units are at higher risk of this type of pneumonia. The third type of pneumonia is the healthcare acquired pneumonia. So these bacteria are acquired in long-term care facilities or who receive care in outpatient clinics, including kidney dialysis centers. So like hospital-acquired pneumonia, these bacteria are also very resistant to antibiotics already. And the last type of pneumonia is the aspiration pneumonia. Aspiration pneumonia occurs when you inhale food, drinks, vomit, or even saliva into your lungs. As we all know, these substances are not supposed to be found within our lungs. So once this happens, complications may arise if they are aspirated. So aspiration is more likely if something disturbs your normal gag reflex, such as a brain injury, swallowing problem, or even excessive use of alcohol or drugs. Now let's go to the pathophysiology of pneumonia. So what happens when a person is infected with pneumonia? First, the patient or the person has inhaled or was exposed to the bacteria, and the most common type of bacteria is the Streptococcus pneumoniae. So there are several predisposing factors that a patient or a person can have in order for him or her to acquire the disease. So we have age, asthma, or any respiratory problems, or patients who have COPD or chronic obstructive pulmonary disease, patients who have history of smoking, or patients who are smokers, and many more. So that will be discussed later on as we go on with our discussion. After inhalation or exposure to the bacteria will invade in the lung parenchyma. When this happens, our body senses that there are pathogens inside our lungs, and it will activate our inflammatory response. So one of the effects of our inflammatory response is that our blood vessels will dilate and capillary leak occurs, so that our blood vessels will become more permeable in order for our leukocytes to enter the alveoli or our lungs. Next, inflammation of alveolar sacs occur because the bacteria has already reached the alveoli or alveolar sacs. Once this happens, the white blood cells will accumulate within our lungs or the alveoli. So the first white blood cell that will respond to the inflammation are the neutrophils. Next, formation of pus and exudate in the alveoli occur because of the presence of the bacteria and also the cells that are already fighting the infection or fighting the bacteria. So we all know that there are already presence of cells or WBCs and pathogens inside the alveoli. This can cause the production of sputum. So when this happens, there will be a disruption in the ventilation of our lungs. So air cannot freely enter the fluid-filled alveoli. And the effect of this is that the patient will have a hard time breathing already. And when this happens, the parenchymal and alveolar sacs tend to consolidate, or what we call harden, because of the fluids that are inside the alveoli. And also because of the low oxygen concentration of the lungs, which then leads us to our disease, pneumonia.
So now let's go to the symptoms of the disease. So first symptoms is chest pain when you breathe or cough, and of course shortness of breath or SOB. Cough, which may produce phlegm, is also present, as well as Nausea, vomiting, or diarrhea is experienced. Next, the patient may also experience confusion or changes in mental awareness, especially for those who are 65 years old and older. Also, the patient may feel or experience fever, sweating and shaking, chills, and lower than normal body temperature, especially in older adults that age 65 years and older, and for those people who have weak immune system. So next, we will move on to the risk factors. So the people who are more at risk of developing the disease are people who are 65 years and older, as well as those children who are 2 years old and younger. So in short, these persons who are immunocompromised are more at risk of developing pneumonia. So we have also other factors which includes first is smoking. Why? Because smoking damages our body's natural defenses against bacteria and viruses that may cause the disease, which is pneumonia. Also, we can be more at risk of developing the disease if we are hospitalized. So this type of pneumonia, which is the hospital-acquired pneumonia, because if we are in the hospital, we are more exposed to microorganisms, and we can harbor that or we can acquire that. Next is chronic disease. You are more likely to get pneumonia if you have asthma, chronic obstructive pulmonary disease or COPD, or heart disease, because these diseases may also weaken your immune system that makes you more at risk of developing that disease. Next is people who are weakened or who has suppressed immune system. So these people are those who have HIV or AIDS, who've had an organ transplant, or who have received chemotherapy, or those who receive long-term steroids. Now let's move to the complications. So if the disease will not be prevented nor treated, it may complicate. So the complications include, first, bacteremia or bacteria in the bloodstream. Bacteria that enter the bloodstream from your lungs can spread infection to other organs, potentially causing organ failure. Next is difficulty breathing. If your pneumonia is severe or you have chronic underlying diseases such as COPD or asthma, you may have trouble breathing in enough oxygen. You may need to be hospitalized and use a breathing machine, which is a ventilator, while your lung heals. Next is fluid accumulation around the lungs or pleural effusion. Pneumonia may cause fluid to build up in the thin space between layers of the tissue that line the lungs and chest cavity, which is the pleura. So the last one is lung abscess. So how do lung abscess occur? It occurs if pus forms in a cavity in the lung. An abscess is usually treated with antibiotics and sometimes surgery or drainage with a long needle or tube placed into the abscess to remove the pus. So these are just several complications of pneumonia, and if these complications will not be treated, it may lead to death. So now let's move on to the medications. So as nurses, we need to know or determine what are the medications that we are going to administer to patients with pneumonia. So first, we have ceftriaxone, which is a third generation cephalosporin, which is an antibiotic, since the main causative agent of our disease is bacteria and other organisms. So the several side effects include swelling, redness, pain, or soreness on the side. So as nurses, our main responsibilities is, first, we need to inspect the injection sites for induration and inflammation, rotate sites, and we should note IV injection sites for signs of phlebitis, which includes redness, swelling, and pain. We need to also Note that we should not administer the drugs on the site of IV injection. So the next drug is azithromycin, which is under the classification of macrolide antibiotics. So several side effects of this drug includes diarrhea, nausea, and vomiting. So as nurses, we need to monitor for and report loose stools or diarrhea since pseudomembranous colitis that must be ruled out. We need also to monitor patient and the international normalized ratio closely with concurrent warfarin use. Next drug is albuterol, which is bronchodilator. Hypersensitive reactions and cardiovascular such as palpitations, hypertension, bradycardia and reflex, and CNS, which includes tremor, anxiety, nervousness, restlessness, and convulsions, are just several side effects. So as nurses, we need to monitor therapeutic effectiveness, which is indicated by significant subjective improvement in pulmonary function within 60 to 90 minutes after drug administrations. We need also to monitor for signs and symptoms, such as fine tremor in fingers, which may interfere with precision hard work. CNS stimulation, particularly in children 2 to 6 years old, which includes hyperactivity, excitement, nervousness, and insomnia. Next drug is under the classification of mucolytic is acetylcysteine. Side effects includes bronchospasm, disagreeable odor, and drowsiness. So as nurses, we need to monitor or note that during IV infusions, we need to carefully monitor for fluid overload and signs of hyponatremia, which include changes in mental status. We need also to monitor for signs and symptoms of aspiration of excess secretion and for bronchospasm, which is unpredictable, withhold drug and notify physician immediately if either occurs. Next is benzonatate, which is antitussives. Several side effects includes drowsiness, headache, and nausea. As nurses, we need to auscultate lungs anteriorly and posteriorly at scheduled intervals. Observe character and frequency of coughing and volume and quality of sputum, and keep a physician informed. Lastly, we have acetaminophen, which is under the classification of antipyretics. So several side effects includes nausea, headache, and hypersensitivity reaction. So we need to consult physicians if needed for children who are less than 3 years old if needed for longer than 10 days of administering the drugs. We should also avoid using multiple preparations maintaining acetaminophen. So those are medications who are commonly used in treating pneumonia. Next is prevention. So it is said that prevention is better than cure. To help prevent pneumonia, we need to first get vaccinated. Vaccines are available to prevent some types of pneumonia and the flu. Especially children must get vaccinated. Doctors recommend different pneumonia vaccine for children younger than age 2 and for children ages 2 to 5 years who are at particular risk of pneumococcal disease. To prevent pneumonia, we need also to practice good hygiene. Of course, it is to protect yourself against respiratory infections that sometimes lead to pneumonia. We need to wash your hands regularly or use an alcohol-based hand sanitizer. We should also not smoke because, as what I've said earlier, smoking damages our lungs' natural defenses against bacteria and virus. Of course, we need to keep our immune system strong. Get enough sleep, exercise regularly, and eat a healthy diet. So these activities are just some activities to prevent the development of pneumonia. So these are our references.
So that ends our discussion on pneumonia.
We hope that you learned something from this video.
Thank you so much, and
God bless!